Good afternoon, everybody. We'll start promptly on time today. Thank you all for joining, and I'm sure we will see folks join as we get rolling. A couple housekeeping things to run through. One, there is a Q&A function in the webinar, so you will be able to ask questions throughout. Two, we will be sending a survey out following this to make sure we can constantly improve the webinar. So if you have any thoughts, feel free to do that. And three, we will be sharing this webinar afterwards so that you can rewatch it or share within your organization. So that link will be up and out the door tomorrow morning. So with that, we'll start rolling through the slides. I'm joined today by my colleagues, Stephanie Gower and Ian Chesney. Stephanie is heading up our government relations, especially in the pan-Canadian world across many provinces. And Ian Chesney is a senior consultant focused on federal and pan-Canadian files. The three of us are thrilled to join you today to run through the latest on the federal government coming out of the budget last week. We'll flip to the next slide. Many of you probably know who Santis Health is. I will be very brief. We are a health and life sciences consultancy. Most of you on this call, I would think, have some familiarity with us and work with us. Our one thing that sets us apart from the rest is that we focus solely on healthcare, and that is the lens that we were going to be going through this presentation. So we'll just flip forward, and I think I'm going to be passing it over to my colleague, Ian, to run through the current environment. So Ian, why don't I flip it over to you?
Thanks, Peter. All right, so to start off, we'll just give an overview, as Peter said, of and set some context for later in the webinar that will be useful. And we'll start with a main or an overview of the main healthcare issues that have been the focus of public attention, and then shift to some political polling to help set further context. And we'll kind of come back to this as we go along. So to start off, this is information that we compiled based off of Google Trends, which is a website that analyzes the popularity of various search queries on Google and cuts across regions, languages, and timeframes. And this is a tool that we've used for clients in the past for advocacy and other related purposes. And it's useful because, unlike traditional media monitoring, we can actually see where and when Canadians are actively engaged on specific issues as they relate to healthcare. And of course, in many cases, these are issues that are priorities for government directly. So the three we're looking at right now cuts pretty broadly across healthcare priorities. Of course, these are non-COVID related priorities related to pharmacare, long-term care, and mental health and addictions. And this just gives you a sense of where people are most actively engaged on these priorities across the country. And you see pharmacare pretty consistently throughout this, but there are noticeable exceptions over the last few months, particularly in Ontario, where of course there's been a lot of active media related to long-term care, and with other government policy underway, such as the commission, the report of which will be coming out over the next few days. We tend to see a little bit more activity on that policy issue specifically. So we'll move to the next slide. Now, shown differently, we can see at what times over the last few months attention on these issues has actually spiked, and sort of where throughout the last year these have kind of popped up again and again. And again, you do consistently see a pretty strong interest in pharmacare. Now, this does vary at different times and has throughout the last few months, obviously, particularly at certain times over the last few months where there's been a lot of discussion on other priorities, specifically long-term care, or sort of in the days following kind of major announcements by government that tend to get significant media pickup in the days following, and that obviously can have an impact on obviously the public's attention that's on these issues, how engaged they are on these issues, and a lot of that, of course, is driven by the media cycle around them. So moving to the next slide. Now, of course, COVID-19 has been the newsmaker of the year by a long shot, far surpassing these other healthcare priorities. And a really good indicator of that is particularly the level of the public's engagement on the issue of vaccines. Obviously, all Canadians, everyone wants life to return to normal. People are very focused on the vaccine rollout, very kind of aware of that and actively monitoring it themselves. And we can see how, again, certain announcements throughout the year, particularly around vaccine approvals or significant increases in supply, tend to drive some of that activity. Moving to the next slide. And finally, a bit on some political polling to help paint some context. So, as you can see, and we've talked about this particularly on the last webinar, and this has been a consistent theme, but the Liberals have held a very strong lead throughout much of the pandemic. And what we're starting to see now is that lead widening even further, much further than it has been in a while support for the opposition is actually decreasing. Now, there have been, of course, noticeable dips in support at certain times throughout the last few months. Obviously, last summer during the We Charity scandal, more recently, earlier in the year when there was some criticism being thrown towards the federal government around vaccine supply. But generally, they've held a pretty strong and consistent lead. And this, of course, is fueling a lot of the speculation that we're all hearing about and seeing around, when will a federal election be called, and a lot of speculation that there could be one this year, which we'll come back to, of course, a little later in the webinar. All right, and now I'm going to turn it over to my colleague, Stephanie, who's going to talk about some of the healthcare related impacts of the third wave.
Thanks, Ian. And I'm not going to spend too much time on these initial slides, as everyone on this call today is acutely aware of what we're facing right now across the country in wave 3. So Patil, if we can go to the next slide, please. So obviously vaccine rollout has not kept up with the spread and of new variants and COVID cases. We're seeing substantially more cases across Canada, outbreaks particularly in essential workplaces, and new restrictions coming into place across many of the provinces. There's many new variants of concern, and those have become sort of the dominant strains in some of the provinces, and the majority of new cases. And of course, some provinces have been hit a bit harder than others, and we're seeing tighter restrictions now happening across the country, really. And the East Coast was faring pretty well compared to Ontario and Quebec, and now we're seeing tighter restrictions coming into place there this week. Next slide. So as we look at the vaccine rollout, and I know this is top of mind for all Canadians, and everyone is wondering when is their turn to get their vaccine. It has been a very political conversation. I would say a year ago, politics really didn't play a role in sort of this discussion, and now governments are taking shots at one another. Provinces placing the blame on the feds for the vaccine supply issues, and particularly conservative governments. And I think that the message really from the federal government, or the rollout throughout all of this, the last, I guess it's 4 months now, 5 months, is under promise and really over deliver. We're seeing considerable amounts of vaccines rolled out every week and scaling up throughout the rest of the spring and summer. But provinces are putting this back on feds and reliant on the vaccine delivery schedules. We've seen a lot of changes to those schedules as well from a few of the vendors, and but also it's all dependent on human resourcing and how quickly the provinces can roll that out, with the sort of new unofficial target from the federal government as a first dose to every Canadian that would like one by sometime this summer. Next slide, please. So this is a really interesting slide, and I just want to spend a bit of time on this. And this is actually all information that the Santis team compiled, as there isn't really an easy way to get a sense of the pan-Canadian ICU numbers. Canada has some of the lowest ICU capacity in the Western world, and I think it really started us off on the wrong foot for managing COVID in the first place. There's a growing trend of younger people now ending up in the ICU with COVID, and I think that's correlated with the new variants. And this is, showing each province the number of COVID patients versus the ICU capacity. I think, the conservative estimate of the percentage of ICU beds in use pre-COVID was around 80%. And I think it sort of just shows why in sort of the hardest hit provinces, we're seeing pediatric and rehab hospitals now being forced to take on ICU patients. And I think, as we see in Ontario specifically, we're seeing the science advisory table calling for stricter public health measures to bring these numbers down. Cases seem to be, plateauing slightly in Ontario now, but I think the next 2 weeks are going to be extremely telling, just to see sort of where we're already at ICU capacity, and these numbers were from last week already. Next slide, please. So in terms of backlogs, it's actually sort of really interesting to see this. And this particular slide is looking at Ontario specifically, but as ICUs become overrun, provinces are really forced to halt their non-urgent surgeries, procedures, and even the initial meetings with surgeons and consultations. And this only builds on the previous backlogs from waves 1 and 2. And I think in recent projections in Ontario alone, it could take up to 3 years, if not longer, to clear these backlogs. And these numbers were from earlier in April. I think we're actually going to be seeing a lot closer to 300,000 delayed surgeries in Ontario alone. Next slide, please. This slide just touches on sort of the public health measures, and if the restrictions are really working in this, again, measures may be starting to have an impact as cases appear to be leveling off, as I mentioned earlier. We've had some new restrictions on international travel and flight restrictions, especially from countries with variants of concern, border changes, and I think compared to the previous waves, governments will be a lot more conservative in lifting these restrictions. In Ontario, we're under a pretty strict stay-at-home order, and will that continue? I think there's a lot of questions around if children will be going back to school at all for this school year. I think it's a little too early to tell, and I think that variants, could change all of this very quickly. But at this point, it looks to be that these measures are really making an impact. And the last sort of slide I'll touch on is just in terms of provider burnout. And I think this is a really interesting chart. And surveys conducted in 2020 really highlighted the significant increases in burnout in hospitals, long-term care, retirement. And I think it speaks to this as well, that the Armed Forces, Red Cross are all coming into Ontario, and the feds have approved that, and for logistics support and just human resource support, support coming in from Newfoundland today. And it really does set the stage for sort of the post-pandemic reality that our health workforce has just been totally swamped or overwhelmed throughout this entire pandemic. And also, we have not seen any major compensation increases or efforts to increase this capacity over the last year. So hopefully this leads to more of a focus post-pandemic. And I'm sure we'll have some questions on that after this webinar. And now I will turn things over to my colleague, Peter.
Thanks, Steph. So Patil, let's just advance to the next slide. Let's start talking about the budget, politics, elections, speculation, the stuff that we love to say and the stuff that you love to hear. So we'll just flip to the next slide and start in. So the highlight of this budget obviously is national childcare. The government clearly made a political calculus that they will respond to the needs of the electorate more with national childcare than say anything else, like Pharmacare. And we'll talk about Pharmacare a little bit in this section. The politics of national childcare are well known in the Ottawa scene. Many of you who have lived through the past 20 years will know the Liberal commitment for it, the budget that the 2005 budget that had that commitment in it that ultimately failed when the Jack Layton NDP voted them down, kind of puts the NDP of today into a little bit of a bind. But I don't think the NDP made any qualms about supporting the budget thus far because the challenge of entering into a campaign during the third wave. Needless to say, long-term care ended up being the big health commitment in this budget, which is surprising, but actually not surprising at all, considering how much the long-term care profiled during the pandemic in the last year. But it might come as a surprise considering the number of other health commitments that the federal government had at play, and the fact that this is a pandemic budget. So why don't we advance to the next slide and we can get into those things. So it's a bit of a smorgasbord. I'm gonna be honest. It's a budget that when it comes to healthcare gives a little bit across the board, some nice wins in there for researchers, for many of the health charities that are doing health research, a little bit of money for biomanufacturing. I tend to say this government likes to operate on a key message. They want to make sure that they have an answer to any question that they could come up. Politically, that it's clearly an advantageous approach. Stepping back from the political imperatives, and let's get into public policy nerds, it creates a little bit of a challenging environment because the government might have an answer on something, but it's not necessarily the best public policy answer that stakeholders or that the population indeed might want. For instance, the government has $500 million a year for high cost rare drugs. However, I think you would hear from a lot of stakeholders that the focus isn't around high cost rare drugs. It's about supporting people with rare diseases, and what is the best way to do that, and what is the best way to use the funding, which is set to kick in 2022. This has been a commitment that's been in the budget for a number of years. So I would say that it gives a good amount of money to the healthcare sector. I think it lacks a thread, a theme, and I think it lacks a particular response to the pandemic that we're going through from a healthcare perspective. And I think I can put a finer point on that in the next slide, if I remember correctly. Noticeably absent. Pharmacare is one that I would describe as a policy that is embedded in a lot of process. It has a long runway with a lot of off ramps. I think it's curious to see whether or not this is an indication of whether or not the government's committed to Pharmacare. I would say that that's probably not it, considering they launched the Canada Drug Agency Transition Office a couple of weeks before the government, before the budget, I should say. The big challenge with Pharmacare is it's almost a cart before the horse thing. Until you start seeing numbers baked, like dollars in a budget for it, it's hard for it to be real. But at the same time, until you define exactly what Pharmacare is and until you figure out what provinces are on board, what sort of amount of money do you put to that? So that's the challenge, I think, from a public policy standpoint with the commitment around Pharmacare is it's not real until it's real, but it's real to some people, but it's not until we see the numbers. And I know that that's a very confounding statement that I just made, but it's a challenge that this government has where they put a very lofty policy in the window. And it's not one that has a clear definition or direction. It will take a lot of time to tease out. And the issue that the Liberal government will have is they put a big policy in the window that means a lot of things to a lot of people. and their progress on it will be process-based. And I think it will maintain a process-based progress for some time, and whether or not the electorate is going to respond to that. The Canada Drug Agency, also absent from the budget, but we saw a press release a couple weeks before. I would imagine that with a new CEO of that organization, the transition office, I should say, there will be more public work on that. I think this is a bit of a black hole for a lot of people invested in the drug reform world. What is the Canada Drug Agency? What will it do? How will it do it? When will it consult? There's a lot of questions that hopefully will start teasing itself out over the next year, especially as the rare drugs strategy and process unfold a little bit with a little bit more definition. From a budget that spoke a lot about biomanufacturing, a concrete, clear thread of a holistic life sciences strategy, you would think that this would be the opportunity for that sort of commitment, especially in light of the elevation of the pharmaceutical industry over the past couple of months, delivering on vaccines and maintaining supply chains for all sorts of other drugs throughout this entire pandemic. The PMPRB has featured prominently in previous budgets and mandate letters and documents, less so now. That might be an indication of the government knowing that they delayed this policy back in December. It could perhaps be an indication that it's not one that they necessarily want to promote significantly because of the negative reaction to the policy across the board from a stakeholder perspective. I think this is one that will continue to challenge the government. There'll be continued to challenge to defend if it is still a relevant policy in 2021 compared to 2016. At the same time, this government has a caucus and a party that just voted overwhelmingly to move forward with Pharmacare, and it does carry significant support amongst people within the party as well too. Front of package labeling and marketing to kids. This is one that I've been watching for years now, and I know that it has been in every mandate letter and commitment, and it was actually in their 2015 platform. A lot of this stuff. The fact that it wasn't profiled seemed to be a little bit of an absence because it has been prioritized so heavily in previous documents. And the biggest thing, and this is because this was a pandemic budget. This is a budget right in the midst of wave 3. Stephanie just went through all of the impacts in the healthcare system across the country. They indicated that they gave $4 billion in one-time CHT transfers to help PTs prior to the budget. But considering that this was such a significant moment in the pandemic, I would have thought that there would have been some sort of signal to how the federal government is going to support the biggest backlog that the healthcare system has yet to face or has faced, especially when the system is as completely exhausted as it is. Patil, we'll move to the next slide. So I think, Ian, we'll switch it over to you to run through the FPT issues.
Thanks, Peter. So to set the context on this, as Peter pointed out, the budget obviously included a significant focus on childcare, and that seems to be where the government is putting most of its focus from an FPT standpoint for the near future. Now, given that that commitment to childcare, that is likely to take up significant negotiating bandwidth with provinces and territories. But we still do have these other healthcare related commitments. One obviously being national Pharmacare dating back to 2019, and the other more recent with respect to the creation of national standards for the long-term care sector. And on both of these commitments, in this budget and the one previous, we have seen some funding and some kind of beginning stages to move these commitments forward. But it's possible that we're going to see these more and more take a bit more of a backseat, particularly as the focus shifts more to childcare, a program that the federal government will need significant buy-in from the provinces and territories if that's going to be successful. So to take national standards as an example, last year, particularly at around the time of the throne speech, We saw a pretty punchy commitment from the federal government around the creation of national standards, language that would imply kind of maybe more of a regulatory approach, and kind of a significant focus on this area. If you compare that to the budget from last week, the language seems a little bit softer and a bit more passive in comparison. There is this 3 billion sweetener over the next 5 years to provinces and territories, but the approach seems to indicate that it could be a little bit more about sort of incentivizing provinces to meet voluntary standards. Now we'll see how that process moves forward, but it's very telling of how priorities could be shifting on the FPT standpoint more to childcare, and these priorities sort of being deprioritized in the coming months. All right, so I think we can go to the next slide.
I think that's a good segue even into this slide, actually, as all opposition parties agreed that this budget did not go far enough to support the provinces and territories, specifically with healthcare, especially looking post-pandemic. And most of the opposition parties were also fairly critical of the childcare strategy, linking it sort of to other quick promises this government has made, and have not moved on substantially in the last few years. And not surprisingly, the Conservatives did not see the fiscal restraint that they had hoped for in the 2021 budget. Significantly larger deficit at 354 billion, and sort of commenting on the lack of focus and band-aid solutions that didn't go nearly far enough for Canadian businesses. Conservatives also would obviously prefer to see more traditional economic supports to spur the economy in this time of crisis, and lower sort of the emergency spending, something that is fairly challenging to do. And I think most of the provinces are still in some sort of lockdown or shutdown state. The Bloc is also adding an amendment to the budget to encourage more support for provinces and territories with increased health transfers. But at this point, the NDP have stated that they are supportive of the budget, and saying that an election would be unfair and unsafe at this point for Canadians, as obviously we move through the third wave of the pandemic. Next slide.
I think our team here, we're probably going to tag team this one. We have a couple slides to kind of try and close out some of the lingering questions here. Just a high level reminder, it takes the Conservatives, the Bloc Québécois, and the NDP all voting together to defeat the government. Under Stephen Harper, it only took the Liberals and the NDP voting together. So Trudeau continues to have a strong minority government in the fact that it takes a number of parties to vote down. And if we want to start playing with numbers even more, the NDP could abstain, and the Trudeau Liberals would still win votes, and still win the votes they need to win if the NDP decided to abstain. In terms of how a budget is passed, the process is that there are 4 non-consecutive, though this happened consecutively in the past week, but 4 days of debate where opposition parties are able to put forward amendment motions. Oftentimes that would be the opportunity to signal non-confidence. The budget motion, which is called a Ways and Means motion, which is to improve in general the budgetary policy of the government, that actually passed yesterday. So now that this motion passed to approve the intent of the budget, the government can now put forth a budget implementation bill. And if we go to the next slide, we'll talk very briefly about the budget implementation bill, not to get into too much parliamentary process, but this follows the same procedure that any other piece of legislation would follow in the House. There are 3 readings. There is the ability for opposition to put forward amendments throughout. If they want, they can delay this for a long time. We were talking about this because I think the Ford government in Ontario passed their budget yesterday or the day before, and somebody can correct me if I'm wrong, but that means it took them a handful of weeks with a majority of government to pass their budget implementation bill from when they presented their budget, which was prior to the federal government, obviously. So you can imagine in a minority context how long that might take, and that there is the ability for the opposition to slow things down, and the fact that this would also have to be approved by the Senate as well too, if it's following the normal legislative process. The only caveat here is that the government has the ability to move forward with planning. Bureaucrats specifically will start moving forward with how they would start achieving the budget commitments. It does not necessarily mean that the money is released, that the supply for funding has been granted, but they're able to start moving forward. This is where we start playing around with, is there going to be an election, is there not? What the government has been doing for some time is tracking, and you can go to the next slide, Patil, is tracking what sort of barriers opposition parties have been putting in the way to impede progress. Because there are two scenarios that an election would be called. One, the opposition parties can vote down the government, and we know that that's difficult. Two, the prime minister can walk over to the governor general designate at any point in time and ask to trigger an election. And all of a sudden, they would just need to justify that to the population. One of the things they might do to justify that they need an election is that Parliament just isn't working, that they can't get their budget passed, that it's taking too long, that the opposition is focusing on the wrong things, that there's a lot of process that they can put in the way. That's probably right now the most likely scenario if there's going to be an election, because the NDP has made it clear that they don't want to give the prime minister the election that he might want. They don't want to also be blamed for going to an election. And that goes back to earlier comments around how the 2005 Paul Martin budget failed. This would allow the Liberals, if they go to an election, that they can totally own it. And for those of you that listen to the Hurly Burly, Jenny Byrne, I agree with her point on this one, and I think Scott Reed as well too. We're allowed referencing nerdy podcasts on this. I think we're all in the same boat here. But they basically said that elections, who called the election, who's at fault for the election, is a couple days story and it goes away. It probably is. I don't think that the Liberals would be afraid to go to an election because they would be blamed for it. That's not a reason not to go to an election. I think being afraid of AstraZeneca, Moderna, or vaccines for whatever reason down the supply chain having a hiccup, and the Liberal Party wearing that because they're in government, that's more of a concern for me if I were to go to an election. But these are the two scenarios if they are going to go in the next 2, 4, 6 months. So we'll move on to the next. So let's kind of look forward right now. The implementation bill for the budget hasn't been tabled yet, but the Ways and Means motion was passed yesterday. What happens in government right now is that the Department of Finance will assign leads for different budget commitments because work can commence on that. So if there is something that you are interested on in the budget, departments aren't waiting for the budget implementation bill to pass to start working on it. A lot of the time, this work has been underway for months, and it helps confirm the direction when it's in the budget. From a overall political implication, the personal tax deadline is coming up, and I think we flagged this on previous webinars. There's going to be a lot of issues for people rectifying CERB, rectifying the past year of their expenses and what they might owe or might not owe in taxes. That could be a political thorn for the governing Liberals if a lot of the population that thought were being helped all of a sudden owe a bunch of taxes and money they probably don't have right now. June 23rd is the final scheduled House of Commons sitting day. That includes a couple of weeks of potential midnight sittings. So that would be the point in time in which the budget implementation bill would have to be passed, or they will have to extend the sitting. I would imagine the government would want to pass it far before June 23rd. That also kind of gives you an idea of the shenanigans that can go on in the House that might lead to an election. That's the window, that's the time frame we're working on. Currently scheduled, twice delayed, PMPRB implementation is scheduled for July 1st, 2021. Then the big milestone that the government will be watching and population will be watching if I believe their initial commitment was half of adults will be vaccinated by August 2021, and anybody who wants it can have it by the fall. I think Steph already kind of nailed this one. The key here is to under promise and over deliver, and I would imagine they will comfortably make this deadline. And then in the fall is when COVID supports will end for a lot of businesses, and we will see where we are sitting in the pandemic at that point in time in terms of how the business community may or may not react to that. I think we have one more slide, and then we can get in some. Oh no, two more slides. I apologize. What does this mean for all the health commitments? So this is an amalgamation of budgets, mandate letters. It's not comprehensive. There's lots of things on here, but the government has committed itself to Pharmacare, rare drugs, Canada Drug Agency, a regulatory review of drugs, reframing the risk assessment for the regulatory approval of self-care drugs, so over-the-counter drugs or topicals. There's supposed to be a health accord renegotiation next year. They've committed to reforming the Canada Health Act to better measure the public health system. There are strategies left, right, and center, from concussions to autism to opioids to mental health and long-term care. Virtual care is something that I failed to mention in a what's missing slide. That's something the Prime Minister has mentioned several times that they want to do. Medical assistance in dying, they just passed legislation for that. There's work to do on that. I think I missed talking about palliative care, loosely connected to medical assistance and dying. There is a lot of work that the government has signed themselves up to doing since really just 2019. And I struggle to understand how they have prioritized this list and what they will reasonably get done in light of the fact that COVID is still we're still in the worst, frankly, of COVID, and there's also significant rollout of strategies for vaccine immunization that's happening at the same time. If I were to call out a couple things that are probably really top of mind for the government, long-term care national standards and the funding that's in place there. Mental health is clearly top of mind because it was in the budget. Palliative care, autism, those are the policies that were just highlighted in the past couple of weeks. I would expect there's a lot of work that will get done there, especially because they have funding behind it and timeframes behind it. And a lot of these other commitments, there is no money and there is no time frame. For instance, a dental care study, there's no money or timeline for that. The Canada Health Act is frankly a Pandora's box, and if they were to open that, I would have some thinking in terms of the right moment to do it. But I bet now is not the right time. And this is all in the context of a federal government that's not looking to fight with provinces right now. They're okay with taking little pot shots and winning on the weekend, but I think that they have adapted a Team Canada approach, and they don't want to have a huge fight over health transfers, funding, and the population wants to see governments get along and get through the next couple months. I don't know, Steph or Ian, do you have any comments on this slide before we move on?
No, just I think to your point, like some of these are going to wax and wane a bit. To your point about national standards, you know, they'll need to wrap up that work by the end of this year in order to kind of time it correctly with the health accords that are bilateral health accords that are up for renegotiation next year, because of course that funding is going to be very much, and this goes back to the earlier point about FPT, very much locked into those discussions and how that rolls out and is provided to provinces and territories. So, you know, I think some of these will kind of go through an evolution of being, you know, increasing in priority, particularly as there's work that's directly within their own wheelhouse that they can accomplish, like national standards. And then as time goes on, particularly where they're in more of an FPT negotiation stage, we might see things get deprioritized or slow down altogether.
Caroline on the Q&A just called it a flag for primary care, and that might be a good example of how we scratch our brains and understand if the government can put a check mark back next to that. In the last election campaign, the federal Liberals put $6 billion up for the provinces on healthcare, including to address family doctors. COVID hit. Lots of money has been given for healthcare since the 2019 campaign, well over $6 billion. But if we ask people on the ground in especially Atlantic Canada, do you think the family physician crisis is over? They probably say no. But the federal government would probably be able to have a window to say how much money they gave to the provinces for primary care. So this is where we kind of start getting into the tussle closer to an election campaign, or closer to, did you do what you said you were going to do? And I think I said early on in the campaign, this government operates by key message. They will probably have a message to say, we gave X amount of money to provinces to address things like primary care. And they might believe that they had gotten the job done. I would imagine that from our standpoint, sitting back, we'd probably be like, well, maybe not quite. But then we enter into the world of, well, who's ultimately responsible for that? And did the federal government commit to something that they can't actually achieve? Because that's the provincial governments at the end of the day that need to bring it home. So anyway, primary care is a really good example of the bizarro world of healthcare, and how do we measure success when it's the federal government that makes a commitment over something that is frankly not their responsibility. So I think, Patil, we'll flip to the next slide, and we'll have some wrap-up comments from us, and we're happy to take questions and get through the ones online. At the end of the day, vaccines is still the overarching objective goal, and success will be determined based on if the federal government can maintain supply, and if the provincial governments are supported for getting that implementation of their vaccine programs done. The Liberals will always be vulnerable on this. All it takes is the provincial governments that want to create some antagonistic relationships to get through what they have and point fingers. I would say over the next couple of months, I think Canada will be quite flush with vaccines, given the rollout from a number of vaccine providers, and as the United States starts giving up some of its surplus as well too. I think the past week has shown us that this federal government, despite the fact that we're in a pandemic, it was not a pandemic healthcare budget. There needs to be a lot of work and a lot of rabble-rousing and maintaining healthcare as being a primary focus in the headlines for this government to take concrete action. And I mean that across the board of the multiple sectors within the healthcare sector. And then the biggest thing is that the third wave is just crippling the system. And there is currently no plan to address it. I would say in previous waves, I feel like governments were a little bit more proactive, saying we're getting ready to address this backlog. And I think because governments are swamped in addressing the third wave, they're not able to look ahead that much. But this is a place where the federal government could have at least made a little bit more of an indication that they were going to be there to support provinces to get through this challenging period. So next little while, budget implementation bill. Let's see what happens with the Canada Drug Agency and the drug files in general, PMPRB, rare drugs, Pharmacare, you name it, it's in there. And then election speculation will be high. And we look forward to participating in that speculation just as much as you do. Ian and Stephanie, any closing thoughts here?
Maybe I'll jump in there. So yeah, I think to your point, to Peter's point, there was a lot of high expectations on this budget, and it was similar to the expectations that we saw when the government released their throne speech in September of last year. And unsurprisingly on healthcare, we didn't see it kind of go that extra mile that I think some of us may have been anticipating, particularly all the challenges that Steph pointed out that have only gotten worse during the third wave, such as the backlog in the acute care sector across the country. Now, there is still work that they can do. There's there has already been a commitment from the Prime Minister that came just days following the budget to eventually increase the Canada Health transfer. That's obviously something that premiers have been very interested in for a while, and that is the kind of support that they want, largely unconditional increase in funding for healthcare. But we didn't see the kind of direct targeting, particularly on provincial and territorial jurisdiction in healthcare, that we may have expected, given some of the signals that were coming out prior to the budget. And we have seen more of an approach that returns to being deferential to provinces and territories, respecting kind of traditional assumptions around jurisdictional responsibility for the healthcare system, and sort of a return to that approach. And again, part of that may be due to shifting priorities. A lot of focus needs to be put on childcare clearly in the future. So maybe there will be less room for the federal government to really take the provinces and territories to task on some other healthcare commitments. But regardless, we did not see maybe kind of a full suite of investments and focus in healthcare that we might have been expecting. So it will be interesting to see how this budget is received from a voter perspective, particularly as we go forward in the weeks and months ahead, and potentially get closer to an election in the future.
And I think everyone should be able to see that we have some polling results from our time on the line today. And I don't think it's a surprise to anyone that the majority of people on the line don't think that we'll be seeing a spring or summer election. Personally, I think it gives the opportunity to the opposition to really bolster their support, come out with some pretty robust plans, fundraising, all the usual sort of pre-election pieces, as I think that the opposition across the board has been fairly weak with coming out with their own sort of pandemic related and recovery pieces. So it's really interesting to see that the majority of everyone on the line today agrees with of probably a later election. I think the next question is, do you think opposition parties are focusing on the right issues as the pandemic progresses? And I already spoke to this. It's like I'm anticipating your responses. So, like I said, I think we'll be seeing a lot more, and hopefully seeing a lot more. If there is a longer window of opportunity to advocate on behalf of your organization or company with the opposition parties, now is the time to do that, as well as we're not up against an election window. Platforms are being written and policies developed. So I think there's still a significant window of opportunity to do that. Do you approve how the federal government has handled COVID-19? And I actually think this is fairly in line with the polling results that we've been seeing from all of the sort of national polling firms, that it's fairly divided, that Canadians do either approve or disapprove, and a lot has to do with the vaccine rollout as well. I think we had one other question, Patil. There we go. Most noticeably absent from the budget, and I think everybody, growing backlogs, crisis in provincial healthcare systems, and I think that we address this, and obviously please feel free to add your questions in the Q&A box at the bottom, or raise your hand if you have any specific questions that we can address.
I think there are two questions in the Q&A that we can quickly address verbally, both from anonymous attendees, which will leave me curious to see who they are. So any comment on health and hospital research-based funding for research in general? So the feds did put a bunch of money in there. I think folks would argue it's probably not enough, and there are a few different pots that it is accessible in. I frankly don't think that there's enough money for research in there right now to deal with the backlog and the impacts to research over the past year for COVID. And I also haven't seen this federal government talk about hospital-based research either. So I don't want to pretend to be an expert on it, but that's the best answer I can give you right now. And then there's an existential question that somebody asked, and it'll probably be a good place to call it quits on the webinar, is how long is too long to wait for a federal budget commitment to be fulfilled? That is a very difficult answer to give. I think that people have been waiting for childcare since for several decades. So I don't know if there's a good answer for that. But the only thing that we can say is that you need to keep on the government and hold them to the account for their commitments. Because if you let them get away with it, they're going to get distracted and move on to other things. And then Jane Murphy asks, what do you see as the federal role in healthcare for human health resource planning and supply? Ian, you probably are better apt to take this one if you want.
Sure. Thanks, Peter. Yeah, I think that's a great question. So, I mean, when it comes to HHR and the federal role, as I think you're kind of alluding to, obviously a lot of this is in provincial and territorial jurisdiction, which creates some challenges. Now, we certainly have seen a lot of commitments to national standards across a number of sectors federally. It's almost becoming, I think, a federal policy buzz term. So it's quite possible, they would follow a similar approach to that, national occupational standards, that sort of thing. There are policy levers, I think, that the federal government can pull in this area that can help, particularly when it comes to immigration policy, return of service agreements, and sort of providing incentives to come to Canada and work in specific sectors. Now, I think those are probably the likely areas we're going to see in the future, particularly once we get through the pandemic, and there's a bit more of a focus on this sector. But generally, I think their role will be more about sort of kind of standards across the country, providing more investment to provinces and territories, and looking at kind of those policy levers that are in their jurisdiction, particularly around immigration.
Thanks, Ian. Well, I think we'll probably draw it to a close there if there are no other questions. Just a reminder, we will be sending around a survey and we will be sharing this presentation. We implore you to fill out that survey so we know how to continue to adopt these webinars to give you what you might need most. And we also encourage you to share around the presentation if you so choose within your organizations. Thank you, Ian. Thank you, Steph. And thank you all for being here today. And thank you, Patil, for hosting.